Hello, everybody. Thank you for joining us today. Welcome to our Bonitas Maternity Program webinar, Returning to Exercise and Running Postpartum with Physiotherapist Dominique LeClercq.
Welcome, everybody, and thank you for joining us today. I just want to go on to the next slide. So I'm just going to talk about how your body changes after pregnancy. So initially, you might notice that your breasts are slightly tender and swollen. Your pelvic floor muscles might become quite weakened during your pregnancy. This is due to the increased weight of your baby. And then your pregnancy hormone relaxin. This increases a lot of laxity in your pelvic ligaments, and it can be present for up to 6 months after birth. Your abdominal muscles also stretch to accommodate your growing belly, and there might be some separation in the middle where the muscles join. And then you also might notice some urine leaking when you do any movements or certain activities like coughing. So certain conditions that postpartum runners may struggle with, these are probably our 4 most common conditions. So firstly, we've got musculoskeletal pain, urinary incontinence, abdominal separation, and then also pelvic organ prolapse. Now you might wonder, what exactly are these conditions? So when we refer to musculoskeletal pain, this is pain in the muscles, bones, ligaments, tendons, and nerves. Our urinary incontinence, so this is when there's involuntary loss of urine. Abdominal separation, so this is also referred to as diastasis recti. So this is when your abdominal muscles separate slightly in the middle where they join. And then lastly, our pelvic organ prolapse. So this is when there's descending or drooping of organs. This can be your bladder, uterus, vagina, small bowel, and even the rectum. So there are a few signs and symptoms that we can see if you've got pelvic floor or abdominal dysfunction. So usually there might be some urinary or fecal incontinence. There can be urinary and or fecal incontinence that is quite difficult to defer. So this means you cannot stop it or hold. There might be some heaviness, pressure, bulging, or even dragging in the pelvic area, pain with intercourse, obstructive defecation, and then again also your separated abdominal muscles, or even quite a marked decrease in abdominal strength. And then lastly, just your musculoskeletal lumbar pelvic pain. So this is lower back or your pelvis. So there are some considerations that we would like to take before even commencing exercise. So firstly, I'd recommend to be cleared by your medical professional. This is probably first and foremost. The type of delivery you have, so your vaginal or your cesarean section, this is also quite a big factor when you start determining, okay, when I'm ready to exercise. Also the time point after your birth. So at what point are you now, after you've had your baby, do you want to start exercising? And then a realistic goal of exercise. So to really have a realistic goal, set short-term targets, that's also quite important. And then also if you have symptoms of pelvic floor dysfunction prior, during, or immediately after birth, this is also something we would like to consider. There are a lot of additional factors to take into consideration. So your weight, so increased body weight increases quite a bit of load onto the pelvic floor. So when we say increased body weight, we're talking a BMI above 30. Fitness, so level of function prior to your birth. So start slow, gradually build up. Breathing, this one is probably one of the most important ones. So during your 40 weeks of pregnancy, your baby is growing, and usually what it does is push your diaphragm upwards. So it's important that we want to get your optimal breathing strategies back. So synergy between breathing with your diaphragm, your abdominals, and your pelvic floor muscles. Your psychological status, so screening for postnatal depression. As many as 20% of mothers may experience postnatal depression. So this is also very important that we assist with other coping strategies such as mindfulness, meditation, relaxation, and counseling in conjunction with your return to sport. And then we spoke about abdominal separation, so also your diastasis recti. So screening and managing that condition before we commence return to run. We also have scar mobilization. So whether you've had a cesarean section or a vaginal delivery, you can develop, either you might have had an episiotomy or you might have torn So that will also require suturing. These scars can result in quite a bit of pain and restriction in the beginning. So that's why we say when we mobilize a scar tissue, this is usually from around 4 to 6 weeks. It's very good because it helps with reducing inflammation, improving tissue remodeling, and also preventing fibrosis of that tissue. I also put breastfeeding in as an additional factor to consider, because breastfeeding itself, you can still exercise and breastfeed, but it's more about educating the moms and supporting the moms around timing of the feeds. So your exercise intensity, it doesn't affect the quantity or the composition of the breast milk, and it doesn't impact your infant growth whatsoever. It's more just about going for a run or commencing exercise after you've fed your baby. And then also supportive clothing. So it's very important to have a correct, personally fitted sports bra rather than a compression bra, rather a better support. And then also, due to pregnancy hormones, you might notice that your foot size might have increased by a size, and this can also be altered permanently. So then just to give advice for correct supportive footwear, so that you're at least wearing the correct shoes when you go for your exercise or for your run. And then lastly, sleep. So this is probably the biggest key for recovery, and especially in the early stages after you've had your baby, sleep seems to be golden. So what we try to suggest to the moms is try schedule your daytime naps to coincide with your infant's sleep schedule, just to try at least reduce some of the effects of your sleep deprivation. We've noticed that sleep deprivation in athletes are associated with a lot of injury, and also it contributes to quite a bit of stress, which almost does the opposite of why we're wanting to exercise. So we really emphasize sleep as like the biggest part of recovery. Then we also have a few risk factors for potential issues to returning to running. So if you are wanting to return to running less than 3 months postnatally, this can be quite a risk factor for potential pelvic floor issues. Some moms also have pre-existing hypermobility conditions, so Ehlers-Danlos syndrome. So this essentially means that there's already laxity in the connective tissue, and then now you have your pregnancy hormones on top of that. So there's even more laxity. So this is quite a big risk, because this can predispose you to injury or just a bit of instability at your joints. I included breastfeeding here, but that's mainly just for educating the moms on timing of the feeds and the correct sports bra. And then also pre-existing pelvic floor dysfunction. So if you, before your pregnancy or during your pregnancy, you already started experiencing leaking or a feeling of heaviness or dragging, this can also be quite a bit of a risk. And then I spoke earlier about postnatal depression, so psychological issues. So we're also very concerned that we don't want the moms to jump in too quickly. So we don't want you to do the inappropriate intensity or go for a long run too soon as a coping mechanism. So that's why we also want to bring in other coping strategies with the exercise. Obesity, this is also a known risk factor for returning to running in general. And then also I spoke about the cesarean section or the perineal scarring. So as I said before, it can cause quite a bit of pain and restriction. So that can also be a bit of a risk factor to return to running. So you're probably wondering, what can physios do to help with the postpartum stage? So we like to help moms by improving physical and mental well-being. I feel this is extremely important, especially in new moms or in the early stages. A lot of education. We love to talk, so please, if you've got questions, and talking about everything. So especially the importance of postnatal rehab, and then also returning to running. Improving their pelvic floor and abdominal function, very important, because this is probably one of the biggest changes your body faces after pregnancy. We want to strengthen fitness, and then we also want to facilitate work safely and also correctly. All right, so the biggest question, when can I start exercising? So in the first 3 months, we recommend very low impact exercise. And by low impact, I'm going to speak about it on the next slide with actually a bit more detail. But low impact exercise, no running then. So between 3 to 6 months postnatally at the earliest to start running. But this is a very big guideline because I just feel that every mom is different and should consult their physiotherapist before deciding if they want to start exercising. And even regardless of a delivery mode, I feel it's important that moms consult a pelvic floor physiotherapist so we can comprehensively assess the abdominal or the pelvic floor and determine if you're safe to start commencing exercise. All right, so this is again a very rough guideline. So between 0 to 3 months postpartum, we recommend pelvic floor muscle exercises. You can actually start that on the second day. Deep breathing exercises, meditation, gentle walking, so flat surface, slow pace. I was quite generous actually by saying 30 minutes. So even 20 minutes. I really don't want the moms to push it, but I also understand in terms of the mental health component, it's also good to start mobilizing quite well. And then at 3 months postpartum, so this is when we start with our low impact activities. So walking again, still gentle walking, slow pace, flat surface. Swimming is very good. It also gets the lungs working and very good for deep breathing. Yoga and Pilates. So I know you get different grades of yoga and Pilates. So I would recommend beginner, level 1, very easy. Stationary bike cycling on low resistance, and then also light weight training. So the use of TheraBands or very light dumbbells. Now between 3 to 6 months postpartum, this is when we can start considering, okay, let's start returning to running. So again, I'm still going to recommend walking, swimming, Pilates, cycling, so outdoor cycling on the road, nothing too intensive, and then graded return to running. So again, slow pace, walk if you need, flat route, don't be too hard on yourself. All right, so this is a nice poster that was actually recommended on the UK guidelines. So it's got a little bit of everything. They say for the first year after you've had your baby, so aim for at least 150 minutes of light to moderate activity every week. So don't try to do 150 minutes on one day. Rather, stretch it out a bit, divide it equally, listen to your body, rest if you need to. If you weren't active before or during your pregnancy, start very gradually. If you were active before, restart gradually. So either way, we want it to be a slow, controlled process. And then, as I mentioned before, pelvic floor exercises and breathing exercises, start that as soon as possible. And then another big thing, it's very safe to be active while breastfeeding. I don't want moms to think that the milk production will be influenced. It is safe. And then also another nice activity to add twice a week is light intensity active resistance. So this is with our weights or our TheraBands. This is just to get your muscles strengthened and just to prepare you for your running as well. So right, where do I start now? So first and foremost, I recommend you consult a pelvic floor physiotherapist just to screen, if you have any potential or maybe existing pelvic floor dysfunction that you don't know about or you think is normal. And most of the times I get moms that say to me, oh, they're leaking, but it's fine, it's normal, it will go away on its own. So that is not normal. We can help. We just need you to come to us. So start slow, start small, set short-term goals. So reaching realistic target distances. So don't think, at 3 months you can be running a half marathon. Rather set a realistic goal so you also don't disappoint yourself as well, because you've experienced quite a bit of body changes now. So you can't expect to suddenly go on as if nothing happened before. And then your run training progression. So we recommend before you start increasing your training intensity, rather build your training volume. So start week by week, then adding a little bit more to your time rather than adding speed or heel training or something like that. And then cross-training on alternative days. So cross-training, this can be your light resistance exercises, Pilates, cycling, swimming, anything that's not running. This will also aid you quite a bit in your return to run. And then also don't be hard on yourself. So if you have started your run and you're feeling tired, take a walk break. It will really help reduce your fatigue initially as well. So again, everyone is different. We will guide you according to your current functioning and also if we've picked up any pelvic floor dysfunctions. All right, so what can I expect if I attend a consult with a pelvic floor physiotherapist? First of all, a pelvic floor physiotherapist is a physio that has a special interest in the pelvic floor, in women's health. Additional courses are done. So not all physiotherapists might be as clued up on these topics. So we'll start with the subjective. So as I said before, we love to talk. So we'll take a nice detailed subjective history. This part is equally as important as your physical. So it might even take the whole initial appointment to speak through symptoms. This might also be the first time you're speaking about your symptoms or that you've realized, wait, I actually have an issue that I just thought was normal or I didn't know I could speak to someone about it. And then we'll also speak to you about all areas of your birthing history, your pregnancy, and how that went, and if you've got pelvic pain, pelvic symptoms, diet very important, and then also exercise that you did maybe prior or during or that you want to get to afterwards. So we'll discuss this in quite detail. Then when it comes to the objective assessment, this is basically our physical examination. So we will assess the structures, the muscles, and the tissues. We do an internal manual evaluation of the pelvic floor muscle. So often we hear, but why are physios doing internal evaluations? This can help us quite a bit. So this is where we can identify if there are pelvic floor muscle strength, endurance, or coordination issues. So it's just like any other muscle, they're just internal. So this also identifies if there's any problematic muscles, maybe if your pelvic floor is quite tight, if it's maybe a little bit stretched, or if there's any potential scar tissue. So that's also something we work with quite a bit. And then we want to do a load and impact management assessment. So the whole point of this assessment is we want to see if you are ready to get back to high impact activities like running. We're going to do about sort of 6 activities. You don't have to do all 6. But the point of doing these activities is that throughout the duration of that activity, we want to achieve this without pain, any heaviness, dragging, or incontinence. So walking for 30 minutes, we might ask you to do that at home, and then you can report back to us or keep a journal. At our practice, we can do single leg balance. So hold that for 10 seconds. That's standing on one leg. Single leg squats, 10 on each side. Jog on the spot for 1 minute. Forward bounds, that's just going forward and back, and then also hopping in place, 10 on each side. So if any of those previous activities have caused pain or dragging or heaviness or incontinence, we first want to address that pelvic floor deficit before we suddenly return back to high impact activity. These assessments are quite nice because they can be repeated. So if one of those assessments that come back that they cause a symptom, we can, after we've worked with the pelvic floor, then we can see if it's improved or if there are any changes. And then supportive devices. So these devices may be fitted to assist with pelvic health issues. So this may be if your pelvic floor deficit is a little bit more severe than sort of a mild one. So the devices can be a pessary, so that's essentially a prosthetic device that we insert into the vagina and can actually provide support if there's any prolapse, so if there's another organ that might just be dragging a little bit. And then our continence aids, so that's sportswear and products that aim at just supporting your pelvic floor and then your lower back area. Another thing that we want to assess if you're ready to get back to running is also, it's not all about the pelvic floor. So we also want to test key muscle groups used for running. So we've got 4 Lovely little exercises. So a single leg calf raise, so that's sort of a heel raise. Single leg bridge, single leg sit to stand, and then side lying abduction, so that's just opening your legs open and closed. So we want to then test these things and see how many repetitions you can do before you fatigue. So fatigue, not when you get tired, where you cannot do it anymore, or if your quality of the exercise has diminished completely. But we want to aim to at least achieve 20 repetitions for each test. A big thing, just because if we've picked up weakness, it doesn't mean that it's going to be a big barrier to returning to run, but it just means that we can give you some other exercises to help strengthen those and just to prevent other typical running injuries as well. Then, so you're returning to running. So you've consulted your pelvic floor physiotherapist, you've been cleared, now what? So again, this is a recommendation. We say start with 1 to 2 minutes of easy running and then walking in between to reduce fatigue. Build your training volume first before building your training intensity. We also say aim for maybe 3 runs a week if that is something you can manage, but just not exceeding 30 minutes per run in the beginning. So again, I've been quite generous with the 30 minutes. Listen to your body. You will know if something is not right. If you really feel that there's something not right, then you can always just consult us again. And then cross-training. This is something that is extremely beneficial, and this is sleep included. So other exercises as in cycling, Pilates, yoga, and then definitely sleep. That is our key to recovery. And then just a quick sort of benefits of cross-training. So cross-training just essentially means that you engage in 2 or more types of exercise. So it helps prevent injury, it improves overall fitness, it improves your posture and coordination, it boosts mental strength, and also it's just a faster recovery. All right, so now running with a buggy, because that's the next big question. You're all ready to go for your run, but now let's say you're at home and baby needs to come with. So when it comes to running with a buggy, I strongly recommend that the type of buggy is very important. So the buggy should be intended for this purpose, so not just your normal stroller or pram. A 5-point harness for the baby, fixed front wheels, hand-operated brakes, rear wheel suspension, and then three wheels and a wrist strap. So this is also extremely dependent on your baby's health. You shouldn't take your baby to go for a run under the age of 6 months. We recommend between 6 to 9 months. This is purely to protect your baby's neck and spine. The baby's neck is quite fragile, and we just want to develop some sort of head control before we commence such an activity. And then there's 3 different types of buggy pushing methods. So we've got our push and chase. That's where you actually push the buggy and then you chase the pram. You've got your one-handed buggy running and then your two-handed buggy running. So I would recommend the two-handed buggy running method. This is the most similar to non-buggy running. So your speed and your stride length is more or less the same. You just now won't have your arms on the side, but at least your stride length and speed will be as close to normal as possible. And then just a take-home message. So we really have seen the benefits of exercise and weight training during pregnancy, and this will really aid you in your return to exercise after. If you're considering commencing exercise and weight training during your pregnancy, first see us, so your pelvic floor physiotherapist, so we can assist you with what is safe, what is a graded program, and just so you're not doing too much too soon, because there are some exercises that are not pregnancy safe. And then the main thing I would say is be kind to yourself. So your body has undergone an incredible amount of changes. So don't be too hard on yourself. Take it easy. Come talk to us. We love talking. And then if there's anything you are uncertain of, you can always consult us. I'd like to say our doors are always open, but really speak to your gynecologist, speak to your pelvic floor physio. We really can help you. And then I just want to see if there's any questions afterwards.
Okay, it doesn't look like we have any questions yet. If anyone has a question, you may type it in the chat box and we can ask Dominique for her answers.
If there are no questions today, but there is something that, is on your mind and you maybe thought about it later, you're always welcome to ask us later on. I think this will be uploaded to the website afterwards. But thank you, everybody. Thank you for attending, and I hope you learned something, and I hope it was at least interesting as well.
Thank you for joining our webinar.